Hello, everyone. You're welcome back again to IG Splendid YouTube channel. In today's episode, I'll be sharing my experiences while undergoing chemotherapy treatment, and I will also be highlighting some side effects of chemotherapy on cancer patients. Chemotherapy is a treatment administered to cancer patients. It is the use of chemicals, that is, drugs, to destroy cancer cells. The three major purposes of chemotherapy is to one, to shrink the tumor before the surgery will take place, thereby making it easier for the tumor to be removed during the surgery. Number two is to kill the cancer cells which has spread to other parts of the body. Three is to prevent um, the reoccurrence of cancer after the surgery has taken place. The choices of drugs used for chemotherapy is based on the type of cancer and also how the cancer has spread. About 6 to 8 courses of chemotherapy is being administered to cancer patients. The reason is based on the stage of the cancer and also how the cancer have spread. Each course of chemo is given an interval of 3 weeks. The reason is because to allow the cancer patient to recover from the previous effects of chemotherapy before undergoing another one. And chemo drugs is given intravenously through drip. I remember that one of the major drugs, which is Herceptin, that was administered to me was given on my thighs. Now, based on my experience while undergoing chemotherapy, I remember that on the precise day, that was 16th of June 2021, I was going to the hospital for my first chemo and I was so unhappy. The reason was because I found out that chemotherapy drugs kill the cancer cells and as well the healthy cells. And my major concern as of that time was the eggs in my ovaries. So when I got to the hospital, I explained that to the nurse. And she asked me to put a call across to my doctor, which I did. She prescribed a drug called Zoladex, and that was administered at my abdominal region. The reason for the drug is to preserve the eggs in my ovaries. So, because of that, the chemo day was shifted to 23rd of June. So, on the 23rd of June, I was very excited going for chemotherapy, knowing that the eggs in my ovaries are preserved. And I also see myself as someone who is going to conquer this sickness called cancer. So on the 23rd, I was through with the chemotherapy and I came back. I expected to see the side effect within 48 hours, but I did not. So on the 14th of July, I went for the second chemo. When I came back on the 15th, I started experiencing the side effects of chemotherapy. The first I experienced was weakness of the body. After that, it was vomiting and having frequent diarrhea. Based on that diarrhea, I took zinc, and because of the weakness, I took ORS. But I noticed that it didn't really work much. Why? Because the chemo drugs are very strong. But with time, it reduced. So after some days, I noticed a sore on my mouth, my tongue, my teeth, my gum, were all sore. And because of that, I was finding it difficult to use toothbrush. So I was using mouthwash. Then within 2 days, I noticed that I also started noticing sore on my private parts. The sore was so painful that I would find it difficult to sit down properly. And when I use the restroom, once the urine touches the surface of the sore or the wound, I will feel so much pain. Because of that, going to the restroom, I was finding it difficult, knowing what I'm going to pass through when it comes to pains. As if that was not enough. On my third chemo, I noticed constipation. I had constipation and also bladder control problem. This bladder control problem was too bad that I can't hold urine. But the good aspect of it is that it did not embarrass me in the public. I could remember a certain day I was coming back in the evening where I went to. Before I could open the gate to the entrance to my house, I weed on myself. Why? Because I could not control the urine coming out. Just like I told you, no one that was passing at that point noticed what was happening to me. But it was one very big situation that I found myself at that point in time. Other side effects I experienced was there was no urge for sex. As a married woman, I was having problem with that. Also, there were total hair loss. You can see my hair is just growing now. I'm this hairy person on my hands, on my legs, but when I mean total hair loss, you can see from this picture now how my hair was. Another thing again I experienced was after the first chemo, I had my period. After that period, I didn't see it again. So these were all the experiences I had at the course of chemotherapy. Now I'm going to highlight some side effects of chemotherapy on cancer patients. One is vomiting. Two is total weakness. Weakness to even take your bath, to stand up from the bed. It could be as bad as that. Three, diarrhea. It can either be diarrhea or constipation. Number four is hair loss. Hair loss at areas where you know hair grows in your body. You will have total hair loss on those areas. Number five was the skin color. Based on the kind of drugs being administered, some patients' skin color and nail will change and become darker. But for someone like me, instead of becoming darker, I was lightened up. So I became fairer than the way I was. Number six is bladder control problem. Number seven is low immune system. This low immune system is happens to everyone that is undergoing chemotherapy. And because of that, it is very good you take 1000 milligram of vitamin C because it will help to boost up the immune system. And I forgot to tell you that 1000 milligram of vitamin C was what really helped me based on the sore I was experiencing at the course of chemotherapy treatment. Number seven is blood vision. Blood vision, my, it really affected me. I was finding it difficult to see. Yes, I was this short sighted person, but it became worse. I hardly see anything. In short, because of that, I had to use my eyeglasses consistently. Number eight is problem with remembering things. Some persons will have a problem of memory, remembering things. So, although it didn't happen to me, but it can happen to anyone. Another one again is urge for sex. Urge for sex. Another one, which is the 10th one, is either few or no menstrual flow. 11 was is loss of appetite. I really experienced loss of appetite. And I remember taking drugs that will boost up my appetite to eat food before taking my drugs. So, all these things I mentioned are some side effects which individual experience while undergoing chemotherapy treatment. But one thing in all this is that each chemotherapy a cancer patient go through, doctors prescribe drugs that will help to reduce this side effect on them. Now, this side effect is not doesn't happen to everyone. I have come across a patient who had no of just few of the side effects. I have also come across a patient who never had a stop in menstruation. I have come across a patient who never had a hair loss. And another thing, again, you also need to know is that the more you go for chemotherapy, the more the effects on chemotherapy. But one good thing about all this is that it destroys the cancer cell, which is the most important thing. And for the side effects, you don't need to worry about it. It's just a temporal thing, which once you're through with your chemotherapy, the hair will begin to grow up. Most of the side effects will begin to disappear gradually. So, whenever you're going for this chemotherapy, just prepare yourself. Make sure you're happy because the most important thing is that you're going to survive through it. All right, I'm going to stop here today. In case if you have a question, you're free to drop it at the comment box. Do have a lovely day. Bye.